Okay, let's start with a scenario. Picture this. You've got a health issue, maybe something quite significant, and you need treatment.
Yeah.
But where you live, you're facing these really long waiting lists, maybe huge costs, just a lot of uncertainty.
Yeah, that sounds familiar, unfortunately. It's a situation a lot of people are finding themselves in, well, many parts of the world.
And it's exactly that difficult reality, isn't it, that's driving this really big trend, medical tourism, and specifically people going to India.
Exactly. It's become a major phenomenon.
So that's what we're diving into today. We've been looking through quite a bit of analysis on this, trying to understand why India has become such a hot spot for healthcare.
Hmm.
And our mission really is to unpack the key things for you listening, like what's really driving this, how big is it, what are the opportunities, the things to watch out for, basically helping you get a clear picture.
Sounds good. And maybe the best place to start is the most obvious driver for a lot of patients, the cost.
Right, the money.
And we're not talking small savings here. The difference can be, well, frankly, staggering.
Stagger. Okay, like how much? Can you give us an example?
Sure. Let's take a fairly common procedure, a colonoscopy with a biopsy. If you get that done in a good private hospital in Mumbai,
Okay.
you might be looking at, say, around 30,000.
30,000. Got it. And compare that to maybe the UK. What would that look like?
Well, in the UK, the same thing could easily set you back 3,500 pounds.
I mean, 2,500 pounds, which is what, roughly 4 lakh?
Yeah, about that at current rates,
Yeah.
nearly 4 lakh.
Hold on, so 30,000 versus almost 4 lakh. That's like 14 times more expensive.
Potentially, yes. I mean, it's a huge gap.
Wow.
Now, okay, you have to be a bit careful comparing private Indian costs versus, say, the NHS public system where the patient might not pay directly.
Right, the access is the issue there, maybe more than the direct cost to the patient.
Exactly. But the system cost is high. And for someone maybe paying out of pocket or, if their insurance isn't great elsewhere, that raw cost saving is just undeniable. It makes necessary treatment possible for people who just couldn't afford it back home.
That cost factor alone is massive, but the information we looked at suggested there's maybe an even bigger pull factor for some people, especially if it's serious. And that's time. Waiting time.
Oh, absolutely critical. This is huge. Back to that colonoscopy example. In India, at a good private clinic,
Yeah.
waiting time, minimal. You might be looking at days, maybe a week, tops.
Days. Okay. And in, say, the UK system again.
Under the NHS, just getting the first appointment, the consultation, that could take 6 weeks, maybe longer.
6 weeks just to talk about it.
Yeah, and then you get on the list for the actual procedure.
Yeah.
Then you wait for results. It really drags things out, which is incredibly stressful for patients.
And it's not just the procedures themselves, right? That's the diagnostics, too.
Okay.
Things like scans.
Absolutely. Things like CT scans, PET scans, MRIs.
Mhm.
These are crucial for figuring out what's wrong, especially with serious stuff like cancer.
Mm-hmm.
In India, it's pretty common to walk into a private facility and, get all the necessary scans done, maybe even on the same day.
Same day compared to...
Compared to systems like in the UK, where scheduling those different scans might mean separate appointments weeks apart.
Yeah.
One scan this month, the next one a few weeks later.
Right. It really stretches out the diagnostic process. So why? Why is there such a big difference in waiting times and access?
Well, the analysis points mainly to capacity issues
Yeah.
in a lot of developed healthcare systems. Demand has just outstripped the available resources. Think aging populations, more treatments available.
Right. The systems are strained.
Exactly, like the NHS. But you see similar pressures, maybe manifesting as high costs or delays, in the U.S. system, too. It's not unique to the U.K. India's private sector, on the other hand, has really invested heavily in building up that capacity.
Okay, so putting it together, it's not just cheap healthcare and it's not just fast healthcare. The picture emerging is more like a combination.
That's the key value proposition, isn't it?
Yeah.
It's high-quality care. You've got highly skilled doctors, many trained internationally, working in modern hospitals with, state-of-the-art technology. Combine that quality with a fraction of the cost you'd pay elsewhere and almost no waiting time. That's an incredibly attractive package for people around the world.
And it feels like this has moved beyond just a small niche thing, the scale of this medical tourism industry for India now. It sounds pretty big.
Oh, it's definitely major. The numbers we saw suggest the market size currently is around 1 lakh crore.
1 lakh crore, wow. And the projections, where's it headed?
They're even more striking. The forecast is for that to surge, potentially reaching 4.3 lakh crore by 2034.
Okay, 1 lakh crore now to over 4 lakh crore in about 10 years. What kind of growth rate is that?
That implies a compound annual growth rate, a CAGR, of roughly 17% over the next decade, which is very strong.
17% a year compounded.
Although it's interesting, some industry leaders, like the chairman of Mass Healthcare, mentioned the source material, they think the current growth might actually be closer to like 25% a year.
25%, that's phenomenal growth.
It is. So look, whether you take the 17% projection or the more bullish 25% current estimate, the direction is clear. It's massive, sustained expansion. Seems driven by these really fundamental advantages India offers.
So if you're looking at this from an investment angle, say, how would you tap into this growth? What's the direct route?
Well, the most direct way seems to be through India's listed hospital chains.
The big players.
Exactly. These are the established companies, many of whom are actively courting international patients. They're clearly benefiting from this trend.
And the analysis mentioned some specific names, didn't it?
It did. You've got the real giants like Apollo Hospitals. It's the largest chain, huge networks. They're like 10,000 beds.
10,000 beds, okay.
Then there's Global Health Limited. They operate the Medanta hospitals, which are really well regarded, particularly for super specialty care. They have about 3,000 beds.
Medanta, right. And Narayan Hudayalaya.
Yeah, they started out famously with cardiac care, but now they're a big multi-specialty player too. And DM Healthcare was mentioned. They've got a strong presence not just in India, but also in the Middle East.
And it's not just the giants, right? There are regional players too.
For sure. Companies like Kim's Krishna Institute of Medical Sciences, strong regionally, and even specialized providers focusing on certain areas, like Rainbow Children's Medicare for pediatrics. It's quite a diverse landscape.
And you mentioned Max Healthcare earlier. Looking at how some of these stocks have done, it gives a sense of the market recognizing this potential, right?
It certainly seems that way. I mean, past performance is never a guarantee, obviously.
Of course.
But the numbers cited were pretty eye-catching. Narayan Hudayalaya was up something like 129% over 3 years. Max Healthcare, even more, over 200% in that same period.
Wow, 200%. That definitely signals strong investor confidence.
Yeah, it suggests the market is really buying into this growth story.
And presumably that confidence isn't just based on hope. The underlying financials must be pretty solid.
They seem to be. The major chains are reporting healthy double-digit revenue growth.
What's driving that?
It's a mix. Increasing patient numbers, both domestic and international, obviously. Also better utilization, higher bed occupancy rates, and significantly a better revenue mix. They're doing more complex, higher-value procedures, which boost revenue per patient.
And profitability. Are they making good money on this?
Profitability looks robust, too. The operating margins mentioned were quite strong. Narayan Hudayalaya around 22%, Max Healthcare even higher, near 26%.
And operating margin is basically how efficiently they run their core hospital business.
Exactly. It's the profit from operations before things like interest and taxes. Margins like 22%, 26%, those are pretty healthy, indicating efficient operations. And Max Healthcare, for instance, apparently had a recent quarterly revenue jump of 35%. Just remarkable growth.
Okay, so strong growth, strong profits. And they're putting that money back into the business. I think the analysis mentioned big expansion plans.
Massive expansion, yes. This is key. They're not just sitting on the profits. They're reinvesting heavily in building more capacity. It shows real conviction about future demand.
So what kind of numbers are we talking about?
Well, Max Healthcare, which currently has around 5,000 beds, plans to add roughly another 4,000.
Almost doubling their size.
Pretty much. Apollo, already the biggest with 10,000 beds, is looking to add around 3,000 more.
Still significant.
And Medanta, so Global Health, with its 3,000 beds. They're also planning to add nearly 3,000 more. Again, almost doubling capacity.
So across the board, they're strategically building the infrastructure, the hospitals, the beds, to capture this expected wave of patients, both domestic and international medical tourists.
So that's exactly what it looks like. They're laying the groundwork for future growth.
Okay, so let's try and tie all these threads together. We've got the issues in developed healthcare systems, cost waiting times.
Right, the push factors.
Then you've got India offering this high-quality, affordable, quick alternative.
The pull factors.
We see market projections showing massive growth ahead for medical tourism to India.
Yeah, 17%, maybe even 25% CAGR.
The listed hospital chains are direct beneficiaries, showing strong financial performance.
Double-digit growth, healthy margins.
And these same companies are now betting big, pouring capital into huge capacity expansions.
Right, building for the future.
So when you put all those pieces together, what's the big picture? What does it tell you?
Well, it paints a picture of what looks like a really powerful structural growth story playing out over multiple years.
Mm.
It doesn't feel like a short-term blip. The fundamental reasons driving medical tourism to India seem incredibly strong and, well, durable.
Makes sense. But like with any investment theme, there are always risks, right? We need to be mindful of those too.
Oh, absolutely. Vigilance is key. Investing always involves risk.
What kind of risks did the analysis highlight for this sector?
A few key ones. Execution risk, for starters. Building thousands of new hospital beds is complex. There can be delays, cost overruns.
Right, big projects don't always go smoothly.
Exactly. Then there's regulatory risk. Changes in government policies, visa rules, things like that, could potentially affect the flow of international patients.
Okay.
Competition is another one. It's getting intense, both among the big chains and from smaller players.
Mm-hmm.
And of course, valuation risk. You need to be sure the price you're paying for the stock offers a reasonable margin of safety, given the future growth expectations are already partly baked in.
So even if the overall sector story is compelling, you still absolutely need to do your homework on individual companies.
Definitely. Look at their specific strategy, the quality of management, check their balance sheet strength, and critically assess the current valuation. Due diligence is crucial.
But stepping back, that fundamental tailwind, you mentioned India's growing role as a global healthcare hub, that feels like the main takeaway here.
I think so. Based on the drivers, the sheer scale, and what the major companies are doing, it feels like a really powerful long-term trend.
So it's certainly a sector that, seems worth paying close attention to if you're looking for long-term growth opportunities within India.
Yeah, based on everything we've discussed, it warrants serious consideration. It's quite something to see how these global dynamics play out.
It really is fascinating, isn't it? How problems in one area, like healthcare access and cost in developed nations, can create such significant opportunities somewhere else, like India's healthcare sector.
It makes you wonder.
Yeah, it makes you think, doesn't it? How many other industries or investment landscapes might be quietly getting reshaped right now by similar connections linking global challenges with emerging market solutions? Something to keep exploring, perhaps.